Hi everyone, welcome. My name is Kelly Meyer and today my presentation is going to be about wet drugs. So first off, what is a wet drug? A wet drug is a marijuana cigarette that is laced with PCP and embalming fluid. Basically, the cigarette is dipped into a liquid mixture of PCP and embalming fluid mixed together. We'll talk about that a little bit later. With marijuana, it is a cannabimetic agent, but with the PCP added, it does include some hallucinogenic properties. Some other names you may have heard in reference to this drug include things like AMP, Crazy Eddie, Purple Rain, Water, Fry, Milk, Illy. A little bit about the history. It does date back to as early as the 1970s, where dealers were looking for a way to enhance marijuana cigarettes. There was also a report of a spike in the use of the wet drugs in the early 2000s. How it became a little bit more well-known was in a few songs by the artist rapper Kodak Black, including a song called Pills and Automobiles and another one called Wet, where he does confess to using the drugs in the lyrics. So what are the symptoms? One of the most notable symptoms does include delusions like superhuman strength. It can also include things like inflammation and sores in your throat, bronchitis, sexual disinhibition, body tissue destruction, hallucination, anxiety, paranoia, drug-induced amnesia, brain and lung damage, feeling of euphoria, and visual disturbances. So onto the mechanism of action. So first off, with marijuana, there are cannabinoid receptors that turn off the release of inhibitory transmitters, and without inhibition, dopamine can be released. THC does mimic anandamide and binds to cannabinoid receptors, and then inhibition is turned off and dopamine is allowed to, in a sense, squirt into the synapse. Then with PCP does inhibit neurotransmitters like dopamine, norepinephrine, and serotonin reuptake. It does this by stimulating tyrosine hydroxylase. Receptors of glutamate are then disrupted, which can affect our perceptions of learning, memory, emotion, and pain. And then lastly, with embalming fluid, it does denature cellular proteins so that they are not able to act as a nutrient source and kill bacteria. They do connect a primary amine group with nearby nitrogen and protein as well. So we do all know that embalming fluid is used at funeral homes to help preserve the human body. But what is in embalming fluid? It does contain things like formaldehyde, methanol, ethanol, as well as some other solvents. So how this comes into play with the use of wet drugs, basically embalming fluid is used as a solvent because PCP cannot dissolve into water. So when you mix the two, it does allow PCP to then be turned into a liquid so that the cigarette can then be dipped into the PCP and embalming fluid mixture. Onto the ADME, first off, absorption. Obviously, it is a cigarette, so it is absorbed through the lungs by inhalation. The half-life of this drug is around 3 days. It's different for each element that goes into the drug. It's 1 to 3 days for marijuana, 1 to 3 days for embalming fluid, and around 3 days for PCP. So it's around 3 days for all of them combined. Onto the distribution. Within seconds, it is distributed to the lungs, bloodstream, and brain. When you smoke the lace cigarette, you can start feeling the effects of the drug within as little as 2 to 10 minutes. Continuing ADME with the metabolism, PCP is lipophilic, so it is heavily metabolized in the liver. But marijuana, on the other hand, is bound to blood proteins and absorbed in the body tissues, and then eventually carried back out into the liver. With excretion, it is excreted through both urine and feces. With PCP, when PCP is excreted through the urine, there is between 10 to 15% of the drug that is unchanged. And embalming fluid can last up to 2 weeks in the body. So embalming fluid does last for quite a while. And then when we look at a specific body system, aside from the respiratory system, as well as your brain, the digestive system seems to be one of the most affected. First off, with embalming fluid, the formaldehyde in that can injure and damage the GI tract, specifically in the stomach and the lower esophagus. And then with marijuana has actually been known to cause cannabinoid hyperemesis syndrome. This happens because your ECS or your endocannabinoid system is overstimulated, and then this can cause severe nausea and vomiting. And then with PCP, PCP is secreted into the acid in your stomach and can form sort of an ionized salt that is not able to diffuse or pass through your gastric mucosa. So you may be wondering, where is everyone getting the embalming fluid from? You can actually purchase, it's actually available at a lot of drugstores and beauty supply stores. Most notably, it is a main ingredient in things like nail polish. With teens as well, it is also very common to be available in their school labs. And lastly, we have seen, since the use of this drug has increased, there has been more and more reports of deaths from funeral homes. And then I did include some warning signs that your loved ones may show, things to watch out for. Can include things like violent or aggressive behavior, blackouts or memory loss. They can also have a nauseating odor coming from their pores. They could also show schizophrenic-like symptoms like paranoia and delusions. And lastly, it's also been known to cause accidental suicide or self-injury. This can happen because they get these delusions like superhuman strength, think they're indestructible, and this can happen. So you may be wondering what the DEA schedule is. It actually is not currently a scheduled drug. I think because it's so new, they haven't scheduled it quite yet. Some other information that I thought was interesting that I wanted to include: this drug is actually not exclusive to lower income communities that we see with a lot of other drugs. It actually has been found more and more in affluent, more higher class suburbs. Typically, it costs about $20 a piece. And lastly, things that I said before about the delusions with the superhuman strength, some users have actually been able to break free from a pair of handcuffs. And lastly, here are my references that I was able to get all the information from for this presentation. Please let me know if you have any questions, and thank you.